Hello, assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to another episode of the MMAC's Community Health Series. My name is Dr. Hashim Khan. I was a guest respirologist on for the last couple of weeks, and welcome to another episode. And this month in November, coinciding with Movember, we're going to be talking about men's health. And this is something that we, in general, as men, don't talk much about. And I'm joined here by Dr. Suleiman Furmli. He's a general practitioner who completed his medical training at the University of Toronto. He has a lot of interests, including preventative health, weight loss, diabetes, metabolic syndrome. He does a lot of work with mental health and ADHD, working with immigrant and refugee populations, and does a lot of travel medicine as well. On the side, he's also quite active in the healthcare tech space, and he's involved in multiple health tech startups as well. And he currently practices in Scarborough as well as in Ajax. So thank you so much for joining us today, Dr. Suleiman, Dr. Furmli.
Jazakallah. Thank you so much, Hashim. It's a pleasure to be here and talking about this in November as well. So to recognize, Men's Health Month. So that's great. Alhamdulillah.
Yes, alhamdulillah. So let's get started. I mean, and there's so many different topics that we as men don't generally like talking about when it comes to our health. So I'm hoping that a lot of our viewers will be able to benefit from a lot of these different things. And maybe let's start talking about, mental health. Mental health is something that a lot of us are speaking about in the community nowadays. It has been something that's been stigmatized. And in general, men talk about it less as well, or we don't necessarily readily admit it. So maybe you can walk us through maybe some of the different issues that men can have and how to sort of recognize some of those mental health problems.
Yeah, absolutely. So mental health is it's a difficult and a very complex issue, both for men and for women. And it affects a very large demographic of our society. I think the statistics I saw last time was somewhere like at least 80% of the population will suffer through a mental health issue or at least once in their lifetime. And in terms of primary care and part of my practice, we see it quite often, very frequently. I'd say maybe 1 out of every 5 to 10 patients have at least some element of mental health. And then for our specific demographic, like for men, and then particularly from racialized backgrounds as well, there's a lot of stigma to talk about mental health because it seems to almost go against the grain of what being a male is to a lot of people, like that kind of idea that men don't cry, men don't really have time to be sad, men just have to be there and perform. So there's a lot of different ideologies, both from different generations, different cultural aspects to it. And then there's just the reality that we deal with. So I think part of addressing the issue is definitely destigmatizing it, talking about it a lot more, making it seem and really exploring that mental health is no different. In fact, can be more crippling actually than a lot of physical and other non-mental health issues. So I think having that discussion with patients really helps clarify for them. Like sometimes when we're discussing a physical ailment like a knee problem or back problem, and then a mental health problem, they might just dismiss the mental health problem, and I'll say, no, actually, you know what, your mental health problem could actually is potentially worse than your knee problem and could be more disabling for you, because your brain is your control center for your whole body, and if your brain is not happy, then it's going to spill over in all these other areas of your life in terms of how you feel physically, how you perform at work, how you perform at home with your family and loved ones, et cetera, et cetera.
That's great, Dr. Furmli. Those are some great reminders. And I guess like you hinted at, just like any other part of your physical body can become unwell and sick and cause you some issues, your mind is also allowed to be sick and unwell. And that's where our mental health comes into play. This is very, topical, especially during the ongoing COVID-19 pandemic as well, where a lot of us have been in and out of lockdowns and restrictions and, stress related to work or finances and relationships and things like that. If someone is, wondering and maybe they are experiencing mental health issues, whether it's, stress or anxiety, or they're feeling a bit sad or depressed, what should they do, or what should their family members do? What do you recommend to patients and their family members?
I think the first major step is to identify it and even sort of quantify it as well. And being because sometimes uh, for yourself as a person, sometimes we're very poor self-observers and we might not realize how things are going, and we might not have that insight. So I think being receptive to that insight from others, and maybe asking others too, and saying, hey, look, this is how I'm feeling. Do you see me also acting this way? And actually before that, even just educating ourselves on what are the signs and symptoms of mental health issues, and how can it look, how can it present itself. So I think that would be number one, because if everybody is more educated and vigilant about looking for these signs, then it's easier to be able to talk to somebody about it and bring it up. Because otherwise, if somebody is going through this and we can't really identify it or show it to them, then it's very difficult to bring up and do anything about it. So I think that would be number one. So maybe we can just roughly chat about some of the signs and symptoms that people might present with, and then maybe we can go from there.
Yeah,
So
for
just
sure.
some, yeah.
What
Yeah,
are
so
some of the
some
most
some
common conditions and things that you see, and how do those, like, how can, as family members or as friends, how can we recognize some of those symptoms and signs?
Mhm. So the challenge, in one sense, the challenge is that it can present in so many different ways, and sometimes it takes a little bit of putting things together to be able to connect those signs to mental health, especially for men, because a lot of times, literally, we will say, "Oh, he's just being a man," or he's just being who, those mention his name, he's just being Abdullah, or he's just being Adam, or he's being Mustafa. That's just who he is, right? So I think knowing, going through all the signs and then being able to put them together, and seeing that potentially there could be something more than just routine, especially if it's something that's being either that's prolonged and it's going on for a long period of time, or something that's a sudden change from who they are normally. So some common things would be things like anger issues, emotional issues, impulsivity, trouble with sleeping, trouble with energy and being more fatigued than usual, just losing interest in general things. You notice someone's not really coming to social gatherings as much, or they kind of lost touch with you or other loved ones, or they're just not doing things that they normally would do that would interest them. So sort of behavioral changes, broad things like that. Um, and then things like just not eating as much as they used to, either changes in appetite, sometimes they're eating too much, sometimes they're eating too little. Sometimes it might show up as weight gain, although a lot of people have obviously gained a lot of weight over the pandemic, but that could actually be a sign that maybe they're suffering more than someone else might be. So just kind of broad changes in work, potentially they've lost their job or they're underperforming at work. um, and they might be doing other impulsive things, like suddenly just getting up and traveling somewhere that they would otherwise not do, or start spending money in ways they normally would not do. So different broad strokes things, and it's just a matter of being able to tune in and saying, look, is this what this person is normally doing, or is this what the average person would do, or is this a little bit extreme or beyond what the average person would do? So if someone's just feeling low for a day or two, that could be normal mood changes that all of us go through. But if they're feeling low on a consistent basis, and it's been many weeks, months, or and it's something a bit more prolonged, then it would be good to talk about those things.
Okay, great. And so, certainly when you said how that the mind and the brain is the command center and it controls all your body, just based on all those different signs and symptoms that you mentioned, it sounds like it can affect so many other parts of your body and also so many aspects of your life as well, and affect your quality of life as well. What do you say when patients or their family members, and maybe in our community sometimes, they think that, oh, if you have a mental health, it means that you're crazy, or maybe that's the reason why they don't necessarily seek help. How do you sort of, first of all, do you see that, and how do you sort of discuss that with patients and their families, if they think that being diagnosed with a mental illness is the same as being, called quote unquote crazy.
Yeah, and actually, just one more point also on similarly, which I also didn't mention, is that a lot of times the um, mental health issues might really spill over into physical issues. So they might actually be complaining of very real and scary things, like, for example, chest pain, palpitations, their heart is racing, they just can't sleep at night. A lot of these other real things, like very severe headaches they might be having, very alarming types of pains, very, very weird abdominal pain, leg pain, a lot of very otherwise stressful things, which may be manifesting in their body, but may actually be a result of unhappiness or some manifestation of a mental health issue happening in the brain. And then coming back to your point is, being able to express that to patients and their family members is definitely it's definitely a challenging thing to do, and it really depends on each individual person and how ready they are to feel it. And a lot of times it's really about explaining to them why that symptom specifically is not related to a physical issue. So a very common example would be like, a chest pain in a 25-year-old male or female, very common symptom. And after exploring everything and discussing with them, I actually will go in and show them the chest anatomy and explain to them that, look, in your chest there's mainly your heart, your lungs, your stomach tissue, and given that your chest pain is happening when you're trying to go to sleep, it makes sense that it's probably not related to your heart, because your heart is most relaxed when you're trying to sleep. It's also probably not related to your lungs, because your lungs are also relaxing, and it's not relating to your breathing. And lastly, it's probably not related to your stomach, because it doesn't matter what you eat, or doesn't really have any relationship with food. So that's why I think, and also because you're mentioning that it's when you're thinking about your day tomorrow or stressful events, that's when the chest pain starts. So because of all these reasons, I'm thinking it's more related to your mental health. And so kind of explaining to them in that way makes them understand. And then once they understand that most of the things we feel anyway, even if it's in your chest, even if it's in the tip of your toe, even though it feels like it's somewhere else in your body, it all stems from the brain. And all our sensation actually originates in the brain, and that's the control center. And if the control center is not in a good state, then definitely your chest might not be in a state, your foot might not be in a good state, and the whole body just might not be in a good state. So I think after really going through the motions and explaining it to them like that, it really helps.
Yeah, thank you so much for that, Dr. Furmli. And I guess just last thing about mental health in general before we move on. If someone comes to you and they just tell you that, okay, fine, I'm experiencing these symptoms, or a family member is, and they come to you for help, you just put everyone on medications, or are there different ways that people can be treated for their mental health issues?
Yeah, the good thing about mental health is, compared to where we were maybe 50 to 100 years ago till now, there's a lot more studying and research that's been done, and also there's been a huge evolution in fields in mental health. So probably even when I started medical school, there actually was not even this college. It's called the College of Registered Psychotherapists of Ontario. So this is a Ontario-based college that newly came into practice to help kind of promote talk therapy. But just to take a step back, usually for most types of treatments, especially for mental health, there's both medication treatments and non-medication treatments. And usually the way that I approach it is, if somebody's mental health issues are usually mild to moderate, meaning that in terms of measuring that and how much it's affecting their life. So if it's just sort of annoying, but it's not enough to make them suffer in any major way in terms of losing out on work or family opportunities, or making them have some other tangible ways it's really causing them to suffer, then usually I recommend using non-medication treatments, which includes a mix of a whole bunch of things. So anything from talk therapy and working with a psychologist or psychotherapist, to doing things like exercise, mindfulness, working on sleep hygiene, doing other beneficial things like engaging with social activities, basically anything possible to kind of promote a healthy lifestyle, and B, to keep the mind occupied on positive things. that'll keep them from going down into more depressing thoughts. And then for people who are more in the moderate to severe category, then I do often suggest considering using both the medication and the non-medication options. And there's two reasons for this. One is because the medication, in cases where someone's really suffering, then you definitely want to use all the tools you have in your armamentarium to help them. So that's number one. Number two, it'll kick in a lot faster than just using one method, because by the time people are able to find a psychologist and do all the other things that they need to do from a non-medication strategy, it could be a lot of time, and sometimes people don't have that much time. And then number three is that in order for the non-medication treatments to work, someone's mental health space needs to be in an adequate area to be able to process all of those things. So if someone's really down in the dumps and you tell them to go to the gym, they probably won't even have the motivation to put their gym bag together, let alone get out and get to the gym. So using the medication really helps to at least get their mental state in a place where they can actually get active to do the non-medication treatments. And even, for example, sitting through counseling and therapy, there's a lot of homework that someone has to do to kind of process things and help make themselves feel better, and making sure that they have at least an adequate level of mental headspace there to be able to make it work will be kind of a prerequisite for that to actually work. Otherwise, you'd just be setting them up for failure. So that's kind of how I approach that.
That's some fantastic advice, Dr. Furmli. Just that there's, besides medications, there's so many other non-medical treatments that are available, and patients don't necessarily have to suffer. So we should perhaps speak more about it, discuss things openly with our families and friends. And we see this all the time, where if you don't talk about things or discuss things, then people might reach for other more immature ways of dealing with issues like stress or depression, whether it might be using substances or drugs or other things that are more harmful than beneficial, and people don't get the help that they need, then it can make them very, very unwell from a mental standpoint as well. And that's where we can see, especially in young adults, sometimes we can see suicide as well, right? So really, really great points for all of us to take home. Jazakallah khair. I guess from here, what I'd like to move on to is just in general, we spoke about mental health because it's not something that's commonly spoken about or discussed amongst men, but why don't we talk about general men's health? So are there things that men in general should be doing? I know it probably varies depending on your age, but are there guidelines for certain tests that we should be doing, or screening, or how we should live our life? If you want to talk about general healthy lifestyle for your average male patient who comes into your practice?
Yeah, absolutely. So for it, most of the screening does depend on age. So as we get older in age, so for example, once you hit the age of 50, for example, we start recommending doing colon cancer screening for both men and women. And things like bone density screening as well, above the age of 60, roughly, or if they've had a fracture beforehand. Besides that, a lot of the things really depend on a person to person basis, and also based on their genetic and family risk factors, their physical risk factors. So a good example would be things like high blood pressure, and metabolic syndrome. So metabolic syndrome basically encompasses all the different parameters related to metabolism. So things like cholesterol, high blood pressure, body mass index, which are related to your height and weight. And also, it's also related to your liver and fatty liver, which a lot of people do have. Yeah, and again, like I said, diabetes and things like that. So just keeping an eye on those parameters, especially. So, for example, if somebody is otherwise fit and healthy, but they have high strong family risk factor for diabetes, for example, we may screen them a little bit earlier and do blood tests for sugar, for example. Blood pressure is a good test to do routinely anyways. A lot of people have blood pressure machines at home, either for their own personal use or through parents, but you can either easily get it done in the clinic. High blood pressure, it's one of those things that they call it the silent killer, because sometimes you don't know you have it until you actually measure it. A lot of people think that they might have symptoms, and that's when they should present with high blood pressure. But a lot of the times it might be creeping up gradually, very slowly over age. So that would be something to look into and keep an eye on in terms of preventative health. And then other things like mentioned, like weight and body mass index, they're pretty good rough estimates of how our overall health is. If we've got too much energy on board, if our weight's starting to go up, then it does put us at higher risk of a lot of different conditions, including diabetes, sleep apnea, fatty liver disease, osteoarthritis, because it puts extra weight on our joints. And then other things like cholesterol, heart attack, stroke, a lot of those types of things. So I think those would be the big ticket items, for men to look into, especially of those from, a South Asian demographic or any other demographic that puts their genetics or family history, put them more at risk of those kind of conditions. And then other than that would be sort of like routine, in terms of vaccinations, making sure all your routine vaccinations are up to date to prevent from things like HPV, human papillomavirus, which can cause certain types of anal cancers and penile cancers. It also causes cervical cancers in women. So we do vaccinate in Ontario, for example, and many provinces, all grade 7 and 8 children for that. And then in general, like sexual health screening is very important as well. Depending on people's risk factors and partner history, looking for sexually transmitted infections. It's very common. I see that a lot in my practice because our clinic is actually located next to a public health sexual health clinic. So we do a lot of testing for gonorrhea, chlamydia, HIV/AIDS, syphilis. So those are quite common, and most of them are easily treatable, like especially gonorrhea and chlamydia, and syphilis as well. And then things like contraceptive health as well, family planning is important for a lot of men and for their partners as well. So those would be sort of some of the common like high ticket items that come to mind.
That's wonderful. Thank you so much, Jazakallah khair. So it sounds like for both our physical and for our mental health, a lot of it comes down to, diet. We are what we eat. Staying active and physical exercise and sleep and making sure we've taken care of all those things that, we hear about all the time, but we may not necessarily place a lot of emphasis on. And it sounds like the foundation for a lot of our health is doing a lot of those things that we might have heard about, but not have taken too seriously or not yet implemented very well within our lives. So Jazakallah khair. Let's move on to talk about now something that's very that is a lot of interest to men, especially young men, and that's hair loss, or I guess even if you're a little older as well. So individuals like myself, might start losing hair when we're in our 20s or 30s and onward, and especially if you have a family history. Is this common? Is it genetic? And what can we do about it? There's so many products in the market and things available. Do some of them work? Are some of them better than others? Do you see patients who come to you for this, or do they go to other doctors or other experts for help in this regard?
Yeah, absolutely. I think especially living in a world where, we look to a lot of celebrities and physical appearance plays a big role for us. I think hair loss probably is a much bigger issue. In my opinion, might be a much bigger issue today than it was maybe, 30, 40, 50 years ago. But yeah, it is definitely a common thing we do see. I do see a lot of men coming in asking for it. In fact, hair loss is one of those topics that there's a lot of stuff online. So usually when men come to see me, they've actually done a lot of research on their own in terms of what's out there in terms of treatments, and they have sort of an agenda, which is both a good and a bad thing sometimes. But usually it's a good thing because it saves me from a lot of education. But first of all, hair loss, yeah, it is very common. It's called male pattern hair loss is what we call it, is one of the names, and in the common scientific literature. So male pattern hair loss is quite common. It's mostly genetic. And I don't know how many people it affects, but probably I would just guess somewhere around 50% or so, or maybe a little bit lower, of men are probably going to lose their hair as they get older, probably around between the 20s and 30s, as you mentioned. And for some people it can be quite distressing, and then for some people, just knowing about it and learning that it is probably just something that they're fated with is a lot of reassurance to them, knowing that there's not something inherently wrong with them, or that losing their hair is not a manifestation that there's something else grossly wrong with their body. So I think that's the big ticket item to kind of address and educate people, men, about. And then in terms of treatments for it, there's both medication treatments and non-medication, so sort of procedures that are done. There's a lot of advancements in hair transplant therapy, as well as there's other hair systems, sort of like wigs that can be put on and glued on and styled as needed. So there's a lot of different products to address this. It's definitely a huge market. Um, and I'm happy to kind of go more into it. It's not too complicated, so I'm happy to share more in detail if you feel it's helpful.
Yeah, let's talk about that, and maybe before, and maybe you can start off by maybe mentioning how do we know whether or not the hair we're losing or the baldness that we have is it something genetic or something that's a normal part of aging versus something else that might be causing it or something that might be reversible? Are there certain things that you look for or test for, and then if everything's fine, do you say it's probably just expected male pattern hair loss? And so then maybe let's talk in detail about some of the different options available to men who might be interested, because I do know that it can affect your psyche and your confidence levels as well, your physical appearance, and so that's why a lot of men do seek out other options for trying to replace their hair. So let's go from there.
Yeah, absolutely. So the main thing is, you want to make sure that there is if there is any reversibility, if it's reversible hair loss, because if it is reversible, then obviously that would be something reassuring and something you feel good that you can do to help that person. So in terms of like reversible causes of hair loss, the two common things would be one is related to hormonal changes or imbalances. And the second one is related to more like vitamin deficiencies. There are other categories as well, like side effects to medications. Obviously, if you're on chemotherapy or some other medicine that can, or steroids or something else that can suppress, your hair growth, definitely it can cause that as well. But just for the sake of conversation, like the two most common things would be, like I mentioned, a basic hormonal issue such as a hyperactive or underactive thyroid gland, for example. Diabetes can sometimes cause this as well. And there'd be other things like Cushing's and perhaps some other types of hormonal imbalances. So those would be good things to look into. And then in terms of the vitamin side, so things like iron deficiency, B12 deficiency, perhaps even testosterone deficiency as well. So in order to kind of help identify those things, it would be good to do a good review of systems and just make sure that besides the hair loss, there is nothing else that is grossly abnormal that's going around the body. And then if there is, then it's helpful to kind of look more and delve more into a potentially reversible cause. So just asking like things. And the problem is a lot of these questions are very general. So usually when I do ask men this, they all say yes anyways. But I would ask them, if they feel like they've gained a lot of weight that they without trying or without any explanation, which could be related to hypothyroidism, for example, feeling a lot of fatigue, generally speaking, which could be also related to hypothyroidism, or even low testosterone, things like mood changes, weakness, just any other tip off that there's something else going wrong systemically in the body. So that would be sort of a good way to screen for those things. And if they do mention anything, then doing some blood tests just to make sure that there are no common deficiencies like iron deficiency or something like that, and the hormones, depending on what they mention. Looking at the hormones as well.
Great. So, Dr. Furmli, so I'm your patient. I've come to you. We've had our conversation. We've done all the tests. Everything's fine. Um, I'm interested in what options you have available for my male pattern baldness. So, what would you normally tell individuals like myself at that point?
So there's two main treatments for male pattern hair loss. One is a tablet called Propecia or finasteride, and the other one it's a cream called Rogaine, which you kind of or a foam that you kind of rub into your hair topically. So both of them are quite effective. Maybe at least they would help maybe 20-30% each. So by using both of them together, you probably see at least 50% regrowth in your hair, just roughly off the top of my head. And The only downside, I mean, there's a lot of plus sides to them, obviously, in terms of the hair growth. The downsides, the main consideration, number one, is that unlike other medications where you can potentially start and stop it and just end up with where you started, with these ones, it does take a strong commitment. So once you start these medications for hair loss, you have to continue them. And if you don't continue them, then you might actually end up losing more hair than you started with. So that's one main thing to consider. So it does take a lot of commitments once you start. And the second thing is the cost. So they do cost quite a bit of money. They're not very cheap to use on a monthly basis. Each one might be around 100, maybe about $100 or so a month, so $200 a month altogether if you took both. And then in terms of side effects, the tablet, it is a hormonal medication. It does lower the testosterone and increase the estrogen. That's how the estrogen is what helps to grow the hair back, because it's a feminizing sort of hormone, and so that's more related to hair growth. So it can cause things like gynecomastia or increase in breast tissue, and it could also cause your voice to change. It could feminize your voice a little bit, and certain things like that. So there are some. It could also affect libido and cause erectile dysfunction for some people as well. So they are reversible. They're not permanent, but those are some things to consider with the tablet called Propecia. And then with the Rogaine, there's not too much side effect because you're just putting it on top. It's just that you have to continue it, and it's a bit of a commitment to take on. But besides that, it's pretty safe. It's topical. It doesn't go in your bloodstream, and the way that it actually works on increasing the blood flow on the scalp, and they say that's what helps with the hair growth. So those are the two common medications that would help. There are a lot of, I often also get asked about non-medication treatments. There's a lot of products that are marketed, but I don't believe they have any scientific benefits. People swear by things like certain kinds of oils or coconut oil and things like that. But as a physician, I can't really sign off on any of those. And then the other treatments would be the hair
Hair transplant,
transplantation.
yeah.
Yeah. So hair transplantation, and then the hair systems is a common one as well. So hair transplantation is like, it's a very there's a lot of places here that have them. They're quite expensive, but basically they just take the healthy hairs from other parts of your scalp that have more hair, and just kind of move them to the parts that are deficient. And so there's various success rates with those, and like I said, they're quite costly. Like in Canada, it could be anywhere from $20,000 around for like a minimum package. A lot of people go to places like Turkey and India to do them because there's a lot cheaper, and they have maybe similar efficacy potentially in terms of the advancement of the technology there. And then hair systems would be another option. So it's kind of like a wig. They put it on, they glue it on top, and then they style it for you. You just go like every month or every 2 months, and you can and they kind of install it, and you can't really tell it apart from real hair for the most part. So those are some options. And honestly, I just tell most of my clients that that the other option is to just leave it and be comfortable with being bald, or having a look like The Rock, or doing The Rock Johnson or Jason Statham, and
On Ragacy.
yeah, exactly, yeah. Sometimes I show them pictures of them to make them comfortable if they can't picture it, and sometimes that's the best option. It's because you don't really have to invest too much. So it's all a personal choice. Sometimes I joke with them and ask them if they're married, and if they say they're married, and I'm like, just don't worry about it. Just go with the Rock look. And if they're single, then I'm a little bit more forgiving.
Yeah, for sure. I know it's it's a sensitive topic and a subject, and something that we do, a lot of men do think about it as well, either themselves or their friends or family members as well. And everyone's always looking for options and things like that. But it's good to know that society has sort of moved on to accepting, it's very vogue and common now, where people who only even have just a little bit of hair loss, they're readily accepting of shaving their heads regularly, because it is a good clean look as well. From a professional standpoint, it's also acceptable as well now. It's more mainstream, so it's good to see that. Maybe in the interest of time, we'll just speak about one more thing, if that's okay, and let's talk about low testosterone. I've had in my practice, I'm seeing lots of patients who are now on testosterone replacement, and I don't know much about it, but are patients either being diagnosed more or experiencing more low levels of testosterone? And what kind of symptoms can patients have or experience, and who should be checked out, and what kind of treatments are available?
Mm-hmm. So I think low testosterone is one of those areas that it might be a little bit more maybe taboo, or maybe not discussed that much in primary care. I mean, I don't remember really learning too much about it in medical school or residency, and but definitely I do see a lot of people who come in, let's say, for injections for testosterone, and so we help administer it for them, and they're mostly being seen in specialist care by endocrinologists. But from a primary care perspective, and from our perspective, when we want to make sure that we're not missing people who come in with it, so that we can at least do the basic tests to see if that could be a problem for them, and then treat it accordingly and refer accordingly if needed. I think that the issue with testosterone as well is that a lot of the symptoms that resemble low testosterone can be very similar to things like mental health issues, like other common hormone issues, like thyroid issues, even deficiencies in iron, because a lot of the symptoms are very similar. So, for example, having fatigue, weakness, low energy, sort of like low motivation, not having as much interest in things. Let's say having erectile dysfunction, having sometimes people present with like hair loss and things like that as well. So, similar to the discussion we just had about hair loss. So the symptoms are very can be very vague and broad, and like we mentioned, one thing interesting about men is, in general, like, most men are very reluctant to seek care in the first place compared to women. So even when men come in to see me, a lot of times in the clinic, they're like, they actually start by prefacing, like, I'm just here because my wife sent me, okay, as if I was gonna like judge them, or or think it's unmanly of them to even come to get help. So because a lot of the symptoms of testosterone could be embarrassing for them to talk about or come to present with, and that could be a reason why it's not picked up and addressed with enough. But so, like I mentioned, any of these symptoms could be related to low testosterone, and having more discussion with the patient and kind of reviewing all these symptoms could be a good place to start, and then make a decision to order at least a screening test, like a basic testosterone test. And even the testosterone tests are quite finicky. Like, you have to make sure you do it in the morning, from between either 7 to 11 a.m. in the morning, or within 3 hours of waking up, if they're like a shift worker or something like that, to make sure that the number that you're actually getting, it's actually related to their true testosterone, and not just related to the fact that it's later on in the day and it naturally came down. So there is a little bit of some artistry there, that and some
And so if your levels are low, and you can have any of those symptoms like you described, which are non-specific, they can manifest in many different ways. Do patients take a tablet? Is that a patch? You mentioned injections? Are there different formulations of how patients would be treated if they had low testosterone levels?
Yeah, so there is a lot of different delivery systems as well for testosterone. I know that they have like deodorant almost versions, like a rub-on gel. They do have injections. They do have patches as well. I think with the pills, I don't remember them. I don't see it being prescribed as a pill often because I think it's related to the availability and absorption of the testosterone. Um, but mostly it's given through one of the methods I mentioned. Either it's kind of rubbed on as a gel or given as an injection or a patch. I think those are the three most common ways.
Okay, great. Yeah. And when someone is diagnosed with low testosterone levels, do patients ever ask you about, well, does this mean, or can you sense that they're thinking that, oh, if my testosterone levels are low, am I less of a man? Because, we've touched on manhood a couple of times already during this talk when it comes to like physical health and mental health and whether or not it's appropriate to seek care. And almost, a lot of men don't seek care because they have to keep up with this image of being strong and not ever being sick or unwell. Is that more prevalent when you're talking about low testosterone levels, and how do patients take that? And what do you tell them if they're thinking that or verbalizing that?
Yeah, and I think it's interesting because I think the answer to that question really comes from who that person is as an individual. So, for example, there could be one individual. There could be two people who have both have low testosterone. One comes in and really is concerned about, for example, being able to perform with their partner, and have intercourse, and that's an issue for them. And whereas somebody else might come in and say, I can't get up and get to work. I can't get out of bed in the morning and get to work because perhaps that's more of a priority for them, right? So I think it really depends on who the individual is, what part of their life they're going through, and it really affects them. It could affect them in very different ways, and I think that's the challenging and yet exciting part about being a clinician, is being able to take that in and then really tune in and try to work that based on what you know about the person, and put that into their medical context to try to figure out a plan of what to do next.
Great, wonderful. Such great advice, Dr. Furmli. We spoke about so many different topics, and unfortunately, we're out of time. But we spoke about mental health, especially when it comes to men, and seeking help and recognizing symptoms early, and what we can do in terms of just general lifestyle style things such as eating a healthy diet, exercising regularly, sleeping well, making sure we're socially active, and keeping in touch with our friends and family, and looking out for each other, but also how to take care of our general health. We spoke about hair loss and what sort of things and conditions can cause it, and what treatments are available. And then we finished off with speaking about low testosterone levels and how that can manifest and what treatment options are available. Thank you so much for your time, Dr. Furmli, today on this Sunday afternoon. I hope everyone watching found it beneficial and helpful. I'm not sure if there's anything else that you wanted to add in terms of, anything else specific from a men's health perspective. We will have a dedicated session. Our next talk will be specifically related to urological issues that are never usually discussed. And we'll have a Canadian Muslim urologist speak about that and those related issues in more detail. But any parting words, Dr. Furmli?
No, I think just to kind of reiterate, I think it's great that we're having this forum to have men be able to or to discuss about men's health and men's issues, and looking forward to any upcoming ones as well, to expand further, and hopefully once the pandemic is a bit more under control, having more interaction with our community as well, to see what concerns what other concerns men might have and discuss them further. But I think maybe just as one big takeaway, I think just encouraging men to be more comfortable with seeking help and reducing stigma from men as well in terms of accessing healthcare and discussing issues. I think would probably be a good takeaway point.
Wonderful. Absolutely. I couldn't agree with you more. Thank you so much once again for your time, Dr. Furmli, and to everyone who's involved in the back end to make this series possible. We'll see you again at the next episode in a couple of weeks' time. Please don't forget to visit our website at www.muslimmeds.ca or follow us on Facebook, Instagram, YouTube, Twitter, and I'm sure there's one more, LinkedIn, using the handle @MuslimMeds. That might have been appearing on your screen as well. And you'll hear more about all our different events and upcoming talks via those platforms. Take care. Jazakallah khair and assalamu alaikum.